Hi, everyone. I'm Aryan Haratian, and today we're giving a talk on the increased use of laparoscopy at ACS Level 1 pediatric trauma centers as compared to Level 2 trauma centers. So some background on this topic. Laparoscopy use in adult trauma has been well documented in literature. There's been increased use over time, and it's been associated with improved patient outcomes, such as decreased hospital length of stay and also decreased risk of wound infection. Now, more recently, laparoscopy has gained widespread acceptance for many elective pediatric procedures. Some of these include appendectomies, splenectomies, and cholecystectomies. Yet still, the role of laparoscopy in the evaluation and treatment of pediatric trauma patients remains a bit controversial. So laparotomy continues to remain the gold standard for pediatric trauma patients, yet it also carries a significant risk of morbidity and also significant risk of mortality. Now, previous reported rates of laparoscopy in pediatric trauma range from 30 to 33% of all abdominal procedures, but most of these reports have been coming out of the American College of Surgeons Level 1 pediatric trauma centers. So just comparing these two types of trauma centers, you have Level 1 and Level 2 trauma centers. Usually your Level 1 pediatric trauma centers tend to be university hospitals. Many staff pediatric subspecialties in surgery, anesthesiology, and radiology, and they typically have a high volume of research coming out of these institutions. On the contrary, your Level 2 trauma centers typically tend to be community or university non-children's hospitals, and they typically have fewer pediatric subspecialties staffed, and they have lower volumes of research coming out of these institutions. Now, the method of our study is we did a retrospective analysis of the Pediatric Trauma Quality Improvement Program for the years 2014 through 2016. So we found trauma patients under the age of 16. We used ICD-9 procedure codes to identify abdominal surgical procedures, and then we conducted a bivariate analysis comparing patients undergoing abdominal surgery at ACS Level 1 and Level 2 centers. And the primary outcomes we were looking for was the use of laparoscopy at Level 1 versus Level 2 centers, and then we also measured patient outcomes, and these included ICU and hospital length of stay, days on a ventilator, and also deep site infection. So the results that we found out, we identified 970 patients who underwent abdominal surgery, with 14% using laparoscopy. So the most common mechanism of injury for our patients was blunt abdominal trauma, and the majority of the cases were performed at a university teaching center, more commonly at Level 1 centers. So what we ultimately found out was that Level 1 centers had an increased use of laparoscopy, 15.6% versus 9.7% in Level 2 centers. Yet we also identified that they had a lower mean injury severity scale. Ultimately, we also noticed that Level 1 and Level 2 centers had similar outcomes, even though the Level 1 centers had increased use of laparoscopy. So overall, they were pretty similar in terms of length of stay for their patients, the number of days on a ventilator, and also surgical site infection. So this is just a quick chart outlining a summary of our results. And ultimately, our conclusion was that there's an increased use of laparoscopy at Level 1 versus Level 2 pediatric trauma centers. We didn't find any significant differences in terms of patient outcomes. And ultimately, we believe that more further studies will be needed to better elucidate the benefit that would be conferred by laparoscopy in the evaluation and management of pediatric trauma patients. Okay. Thank you so much for listening to my talk.